After a long day of work and a cozy dinner with your family, it's finally time for some well-deserved relaxing. You sit on the couch and then out of nowhere it happens again. Your heart starts beating incredibly fast, you start to feel dizzy, and you have the feeling you will faint. You start to worry, am I having a heart attack? Should I call an ambulance? What is happening? Unfortunately, those are common symptoms of heart rhythm problems, and in this video we will cover them all. We will cover how they are caused, when to contact your doctor, and much more. So make sure to watch the whole video so you don't miss any important information. And for those of you meeting for the first time, my name is Raoul. I'm a medical doctor from the Netherlands, and it's my mission to medically educate you, my viewer, because educated people make healthier decisions, which is the whole point of this channel. And remember, I'm just a random doctor from the internet. I know nothing about your personal situation, so always contact your own doctor for personal questions. Let's get learning. Before I can explain heart rhythm problems to you, it's important to recap the function of your heart. And as you might know, your heart is a muscle, and with every contraction, it pumps blood through your body. It consists out of 4 chambers with heart valves. The upper chambers are called the atria, and it's their function to fill the lower chambers, called the ventricles. Your ventricles pump the blood through your body. Normally, every contraction starts in the sinus node, which are specific cells that generate electrical impulses that make your heart beat. From there, the electrical signals travel to the atrioventricular node, which carries the signals from your heart's upper chambers to the lower ones. From there, the electrical signal ultimately reaches your ventricles, which pump the blood through your body. If these electrical signals that coordinate your heart's beat malfunction, it may cause your heart to beat too fast, called Tachycardia, too slow, called Bradycardia, or irregularly. In medical terms, this is called heart's arrhythmia, and this can cause several symptoms: a pain on your chest, dizziness, the feeling that you might faint, anxiety, fatigue, sweating, and a slow heartbeat or a fast heartbeat. Some of these arrhythmias are bothersome but harmless, but on the other end of the spectrum, some of them are life-threatening. Therefore, it is important to know the differences. Therefore, let's dive in a little deeper, and we will start off with tachycardia. Here your heartbeat is too fast and it needs to be above 100 beats per minute. This may include atrial fibrillation, where the atria beat chaotically and irregularly out of sync with the lower chambers. Usually this comes and goes and is harmless. However, it can lead to the formation of blood clots, which can lead to complications like a stroke. This is the most common form of a heart rhythm problem. Another form of tachycardia is ventricular fibrillation. Here, the disorganized heart signals cause the ventricles to twitch uselessly. As a result, the heart doesn't pump out blood to the rest of your body. As you can imagine, this is a huge medical emergency and requires medical care immediately. This is one of the most common forms of an immediate sudden cardiac arrest. Which brings us to the heart rhythm problems where your heart beats too slow, called bradycardia. Here you have a resting heart rate of less than 60 beats per minute. However, it's important to know these rhythm problems can cause your heart to beat so slowly that it isn't pumping enough blood to the rest of your body. However, a low resting heartbeat doesn't always signal a medical emergency or a medical problem, as it can be a sign of physical fitness. There are 2 common examples of bradycardia. First of all, the sick sinus syndrome. Here, the sinus node does not work properly, and your heart rate starts to alternate between too fast and too slow. This can be caused by scarring of the sinus node, which might disrupt its electrical impulses. The second example is a conduction block. This is a blockage in your heart's electrical pathways, which lead to a slow heart rate. These are common examples of heart rhythm problems, but there are more, and I can imagine that you're wondering now, how are they caused? This of course depends on the specific rhythm problem. However, in general, there are several underlying conditions which can contribute to the formation of heart rhythm disorders. A heart attack, blocked arteries, diabetes, high blood pressure, an infection with COVID-19, thyroid problems, sleep apnea, certain prescription drugs, drinking too much alcohol or caffeine, drug abuse, smoking, an excess amount of stress or anxiety. Which brings us to a question which makes my heart beat faster. Can you click the like and subscribe button? No, all jokes aside, these videos cost me a lot of time and effort to make, and it would help out the channel tremendously if you would click them, especially if you're learning a lot. It's free and you can change your mind anytime. An actual important question is, when should you contact your doctor? Is your heart beating too fast or too slow, or is it skipping a beat? Then making an appointment to see your doctor. Do you also experience pain on your chest, shortness of breath, or dizziness? Then please consider to contact the medical emergency line, as this can be a life-threatening situation. If you do contact your doctor, he or she can help you to find out the extent of your symptoms and your cardiovascular risks. The doctor might do this by asking about your medical history, your current problems and symptoms, the medication you're using, and afterwards your doctor might do a physical examination, blood pressure measurements, an ECG, which is a recording of your heart's electrical activity, some blood tests, and if necessary, a coronary angiography, which is a procedure that uses X-ray imaging to see your heart's blood vessels. Furthermore, your doctor might also refer you to a cardiologist or a dietist if necessary. Which brings us to possibly the most useful part of this video. How can you possibly prevent rhythm problems or improve them? And it all starts with lifestyle. Stop smoking, limit your alcohol consumption, exercise at least 150 minutes each week, consume a balanced diet with low levels of saturated fat, salts and sugar, eat plenty of fibers, fruit and vegetables. Maintain a healthy weight, have a structured sleeping schedule of about 7 to 9 hours of sleep each night, and decrease stress by maintaining social contact, doing fun activities, and relaxing. However, in some cases, lifestyle interventions only take you so far, and your doctor might recommend other forms of therapy, such as medication. Your doctor might prescribe antiarrhythmic drugs. Those can help when your heart rate is too fast. These drugs can help to correct the rhythm and restore your electrical current. Most of them come in pill form and are typically used for the long term. Examples are amiodarone, flecainide, and quinidine. Other useful drugs can be beta blockers. These can reduce the workload of your heart and widen your blood vessels, causing your heart to beat slower with less force. Beta blockers might include acebutolol and atenolol. Lastly, because heart rhythm problems may lead to blood clot formation, your doctor might prescribe an anticoagulant. This is a blood-thinning medication, and examples are dabigatran, rivaroxaban, and apixaban. If you tried these long-term medications and they were insufficient to suppress your heart rhythm problems, then your doctor might recommend the cardio version. This is a method to reset your heart's rhythm through medication or by delivering a shock to your heart with patches on your chest. This can restore your heart rate to a normal rhythm. In addition, sometimes persistent heart rhythm problems require surgery. Commonly used options are an ablation. This is a procedure where your doctor threads one or more catheters through a blood vessel to your heart. At the catheter tip, there are electrodes, which can be used to create tiny scars to your heart, which can block abnormal electrical signals and restore your heart's normal beat. And lastly, a pacemaker or an implantable cardioverter defibrillation, an ICD, can be placed. These are devices that are used to control an irregular heartbeat. I hope you know now what heart rhythm problems is, how they can be treated, and what you can do yourself. You can discuss all this information with your personal doctor to come up with a personalized treatment program. If you have any questions, let me know in the comment section. And for those of you that want to keep on learning, check out the special playlist in the description. I hope you learned a lot. Please click the like and subscribe button, as I'm posting weekly medical videos for you, my viewer. I want to give special thanks to my Patreon supporters. Thank you, Sebastian, who's an University supporter. And for those of you that can't get enough, I also have an Instagram account @HowToMedicate. I'm posting there some behind the scenes things. See you next week with a new video. Thanks for watching. Bye bye.